Good afternoon. This is Dr. James Marion, broadcasting via Zoom for our third Thursday at the Susan and Leonard Feinstein Inflammatory Bowel Disease Center here at Mount Sinai Medical Center in New York City. And I'd like to welcome to our Facebook live broadcast a new faculty member here. Actually, not so new now, Bhavana. You've been here for a while. It's just we haven't seen each other because of COVID as often. Dr. Bhavana Rao. Welcome, Bhavana.
Hi, thank you for having me on, Jim.
Oh, the pleasure is entirely mine. And this is really an introduction of you to our Facebook Live audience and to our sort of IBD world here. So I just want to make sure everybody knows who you are, because I really have to make a confession to the audience. I've been trying to think of something that Bhavana does badly, right, that she just isn't good at. And it's been very frustrating since she's arrived here, because she's like a quintuple threat. An amazing educator. The fellows I know absolutely adore you. An amazing endoscopist, an internist who really knows the internal medicine, an amazing gastroenterologist, an IBDologist, a clinical scientist. Anyway, drives me crazy. Dr. Rao is an assistant professor of medicine here at the Icahn School of Medicine and a director of our Fellows Inflammatory Bowel Disease Clinic, which has really taken off with your leadership, and I want to commend you for that. Dr. Rao completed her residency at the University of Pittsburgh, and while doing that, which takes enough time, got a certificate in biostatistics and epidemiology at the University of Pittsburgh. And from there decided just to keep going further uphill to the Cleveland Clinic to do her GI fellowship, which is an amazing fellowship program. And then did, on top of that, an advanced fellowship specifically in inflammatory bowel diseases at the University of Pennsylvania. So enough, my heavens. Also is considered an educator among educators and is part of the AGA Academy of Education and the ACG International Relations Committee. And Bhavana's research focuses on improving trainee patient education and patient education. And the project that we're going to talk about today is an intriguing one and a timely one. It's social, racial, and ethnic determinants of inflammatory bowel disease outcomes. I mean, this is of incredible import at this point in our nation's history and also in the history of medicine. So Bhavana, tell us about this project.
Well, firstly, thank you so much, Jim, for the kind words. And it's really exciting and wonderful to be part of the Sinai family. And I am certainly very happy to have this opportunity to talk about the project that we have going. So, I mean, when we look at IBD care, it's been very positive to note all the great strides that have been made in the last 2 to 3 decades in the form of multiple specialized centers being available and better therapies being available for patients. But we're also noticing disparities in healthcare outcomes among our patients. We have multiple studies showing that Black and Hispanic IBD patients don't do as well as the white IBD patients. This is in the form of increased emergency room visits, increased hospitalizations, lesser medication adherence, and all of that is a proxy for suboptimal disease control. Now, the reasons behind these disparities is poorly understood. Difference in disease characteristics, treatment efficacy has been proposed, but we also believe that a lot of social factors are strongly influencing this, such as health literacy, family support, financial strain, nutritional resources, etc. So we believe that, we need to take a closer look at these social factors to try and understand them, and also then eventually to plan interventions to try address them.
So this is interesting. So this is really an important, because listen, when we talk about outcomes in IBD, we talk about, well, did they get their Remicade in a timely fashion? Did they get their colonoscopic surveillance done as we recommended to prevent colon cancer? And those are, I see, very narrow, but what I'm hearing from you, and I want to just make sure that I'm hearing it correctly, that we are now beginning to discover that social factors can have as much of an impact as some of these very specific sort of medical factors, right? Is that what we believe now, Bhavana?
You're absolutely right, Jim. I mean, I think getting a patient diagnosed in clinic, initiated on the right medication in a timely fashion, plugged into a regular monitoring program, all of this is just one aspect of the treatment strategy in IBD. And despite being plugged in the network, if a patient is challenged by other situations, such as, lack of family support, childcare or elderly care burdens, financial strain because of work or insurance related hassles, lack of adequate access to nutritional food, housing insecurity, if all of these factors are also play on the patient's plate, then it's inevitably going to have a negative impact on their IBD as well. See, for example, a single working parent who is on infusion therapy might find it challenging to make it some of those appointments, and missed doses will definitely translate to worse disease outcomes. A malnourished IBD patient without access to adequate nutritious food will not be able to get to a better state of health. And also I can give you an Asian perspective. Often Asian patients do not have as much exposure and knowledge of IBD within their own patient and family circles. And what this translates to is sometimes diminished family support, as well as social stigma to an extent with the diagnosis of IBD. And this influences the way they pursue as well as adhere to IBD medications. And so as an IBD physician, not just putting the patient on the right medication, but understanding all the other factors that are going into the patient's ability to take the medications, to stay on treatment, and get to a better state of health. All of these factors are really important for us to understand and work on as well.
So this is fascinating to me because we all rotate through our IBD center, and in the IBD center we have just this wide variety of patients, right? And so everybody can come to the IBD center, as they should, and we'll have patients who are coming from, as you say, really socially challenged. I mean, once I recently we diagnosed and worked up a patient who had pretty severe Crohn's disease, who was going to require infusion therapy with infliximab, and the patient was homeless. And I'm going to tell you, it was mind-boggling to navigate everything that we had to do to get this person plugged in so that we knew that they could, and I'm not even talking about, okay, well, do you have Wi-Fi there so we can message you, which is all these things that we take for granted, not only in our own lives, but in the lives of many of our patients. So it's challenging. And then I also have seen this where families or certain groups will almost blame the patients for their IBD because they're not eating right, or the mothers blame themselves or because they aren't cooking right, and the fathers blame themselves because they have it, like it's, you're dealing with a lot of different factors. So there are big factors, and then there are smaller factors. Is there a way that we can sort of objectively measure what impact these social factors are having in any individual patient? Because many of them have several, right?
Right. You're right in highlighting a lot of aspects there. I mean, firstly, in New York, we are fortunate to have the opportunity to work with a wide variety of patients. But with that also comes challenges in being better prepared in providing optimal care that suits each patient's needs. And that's why studies like this are important. That's what I believe. To ascertain what these factors specific to each patient type is, so what we're going to do is essentially ask the patients themselves. We're going to conduct a survey-based study. And in terms of how we can ascertain this, there are validated screening tools available that can measure these different social domains that are known to influence healthcare outcomes. So we can measure financial resource strain, psychological impact, food insecurity, discrimination, social support, etc. we can also measure, disease activity, medication adherence, and health-related quality of life. And then we intend to reach out and include a very wide variety of patients, white, Hispanic, Asian, Black, as well as from different age groups and socioeconomic strata. And eventually, we're going to compare and contrast each of these factors among the different racial ethnic groups to find commonalities as well as distinctions, to try and ascertain, which are the specific challenges or factors influencing care in any particular IBD patient.
Right. So, I like the sound of this, Bhavana, because it, to me, is an extension of what we're already doing with our IBD patients. We're doing a 360 on them, if you will. We're doing an MR enterography. We're doing a colonoscopy. We're taking a full history. We're taking a family history. And what I like about this is that you're taking it out another level where these social factors are, because we would just say, oh, we'll let the social worker deal with it, right? Or that's not what I do. But you're saying, no, this is part of what we're doing. So, for example, when you bring in a patient who has these certain boxes checked, if you will, social factors that could be impacting, that we then have a way to react intelligently. I think that's what it sounds like to me.
Correct. I mean, I think there are a lot of unknowns. We have multiple studies which repeatedly show that, the Black and Hispanic IBD patients do not do as well as white IBD patients. And, it's high time we start investigating further into what are all the factors that are going into play. And we need to look beyond disease biology alone and, address these social factors as well. Another poignant thing to consider is in majority of IBD research, it's white patients that are participants. And it might be, related to inability of non-white patients to participate or a reluctance. But I think either way, in our study, we are making an effort to reach out and to include a wide variety of patients to try and investigate these factors in a little more depth. Because as you say, some things that we find might be unique and unanticipated perhaps, but they give a lot of fresh perspectives and help us better tailor our measures to help these patients with their care.
So I think this is great because, again, there's a certain, it's the old saying, the man in the mirror, right? So the person in the mirror, meaning all of us who are on the other side of the desk from these patients and, clinical subjects and clinical trial subjects, I think it's worth examining our own role in perpetuating some of this. So how do you see this? And again, you took it out to here, and Bhavana, I'm going to take it out one step further. How do you think this is going to address or impact making IBD care of all of our patients more equitable? And I use that word carefully, but I think that is part of this. How do you think this is going to serve that higher purpose?
I mean, I think the first point in trying to address an issue is to understand it. And as I said, this is quite a dark area for us, where we're talking about an underrepresented patient group in our studies. We're talking about hey, their outcomes are not as good, but we do not know what are the factors contributing. We have multiple other studies, even from other healthcare domains, which show that social factors play a very big role in influencing a patient's overall state of health. And so this is a first step in investing time and effort in closely exploring the social determinants in our IBD patients. We're also making efforts to have a very comprehensive cross-section of patients included. So we've actually setting up this project in collaboration with our team at Einstein Montefiore Medical Center. So we have multiple personnel working on this, Dr. Ruby Graywood, Dr. Tom Ullman leading the charge at Montefiore. And here at Sinai with me, there's Dr. Zoe Gottlieb, Dr. John Fred Colombel and Dr. Lena Jandorf. And
I know all of them. And they're all terrific.
yeah,
This is great.
It's a big team. It's a terrific team, and we want to make sincere efforts to reach out, to go with an open mind, to truly hear from patients, to learn, and I think eventually our hope is things we learn will help us tailor the care we provide to make it more individualized, and thus more equitable for all in the future.
Well, Bhavana, I want to congratulate you. I mean, I know you haven't been at Sinai all that long, but you're already making some tremendous inroads into really a very challenging clinical area. So congratulations. And I look forward to hearing more about this. In fact, I'm going to invite you now to give us an update in the future.
Well, I'm really excited to be here. And thank you, Jim, for having me on.
This is Dr. James Marion thanking you for paying attention to our Facebook live Zoom broadcast from the Susan and Leonard Feinstein Inflammatory Bowel Disease Center at Mount Sinai Medical Center in New York City, where I've been speaking with Dr. Bhavana Rao about social determinants in IBD outcomes. Please join us again next month for our next broadcast, and have a safe and warm January.